So you think you have hypermobile Ehlers-Danlos syndrome. Now what? The first step in the process to diagnosis is making an appointment with your primary care provider, or PCP for short. If you don't already have a PCP, you need to get one because they are crucial to the management of your overall health. A PCP is typically a general practitioner. Think the type of doctor you would go to for an annual checkup. Once you find a PCP that you really like, try to stick with them. In this video, we'll go over how to make the appointment, how to best prepare for the appointment, and we'll go over some scenarios of how to talk to your doctor about an hEDS suspicion. Let's get started. It's time to make the appointment. Call up the clinic you wish to go to and schedule the appointment. Make sure to tell the scheduler that you're wanting to discuss hypermobile Ehlers-Danlos syndrome in your appointment. This is important because it gives the doctor a chance to refresh their knowledge on hEDS before your appointment instead of being blindsided during your appointment when you mention hEDS out of the blue. It should look something like this. Happy Family Medicine Clinic, how may I help you? Hello, my name is Laura and I'd like to make an appointment to see Dr. Happy. Okay, I can help with that. What are you seeing Dr. Happy for? I'd like to discuss the possibility of hypermobile Ehlers-Danlos syndrome and get a referral to see a specialist. Okay, how does Friday at 10 a.m. sound? Sounds perfect, thank you. Next, it's time to prepare for your upcoming appointment. First, manage your expectations for your appointment. Most family medicine clinics schedule 15-minute appointment slots, and most family medicine providers have a very limited knowledge of hEDS. Don't expect to hand your PCP a printed out copy of the diagnostic criteria and have them diagnose you then and there. A reasonable expectation would be for you to have a basic, respectful discussion about why you think you have hEDS and to obtain a geneticist referral for an official evaluation. Think about what you're going to say and keep it quick and concise. Second, create a list of reasons why you think you have hEDS. This will help organize your thoughts, and it'll be easy to refer to when you're in the exam room and you get lost and you forget to mention some major symptoms. Third, help out your PCP by researching and finding the specialist that you want them to refer you to. You can do this by searching online for the nearest geneticist to you and calling their office to ask if they are accepting hEDS evaluation referrals. If you can't find a geneticist, you can search for a rheumatologist instead, but make sure to call their office to confirm that the rheumatologist that you want to see is comfortable evaluating and diagnosing hEDS. Finally, if you get anxious at doctor's appointments and tend to shut down the moment a doctor starts to question or doubt you, go over some scenarios in your head about how the appointment could go and how you would respond to each scenario. You could also bring a trusted friend or family member to help advocate for you during your appointment if necessary. Let's go over some scenarios together. Hello, I'm Dr. Happy. I see you're here because you suspect that you may have hypermobile Ehlers-Danlos syndrome. Could you tell me a little bit about why you think that? Yes, I have really hypermobile joints that sometimes come out of place with very little force, and I have a lot of deep muscle and bone pain that I can't explain, frequent injuries like wrist and ankle sprains without having an actual injury event. I bruise easily, I have pelvic floor issues even though I've never given birth, I have a lot of GI issues, and I always get really lightheaded when I stand up. When I came across some information about hEDS online, it seemed like it was describing my life. Well, I think you might be onto something. I'd like to refer you to a geneticist to get to the bottom of this. That would be wonderful, thank you. I'd like to be referred to Dr. Lucky because she's close to me and is accepting new patients right now. Here's her information. That was the ideal scenario for a doctor's appointment, but we all know that isn't always how it goes. In the next scenario, we'll see how we can navigate through an appointment with a doctor who isn't all that knowledgeable about hEDS and doubts your suspicions. Hi, I'm Dr. Happy. I see you're here because you think you may have hEDS. Could you tell me a little bit about why you suspect that? Yes, I have really hypermobile joints. I have a lot of muscle and bone pain that I can't explain. I bruise easily. I have pelvic floor issues even though I've never given birth. And when I came across some information about hEDS online, it seemed like it was describing my life. Well, people with EDS have super stretchy skin, frequently dislocate their joints, and have a family history of the disorder. I'm not so sure that EDS is what's going on here. Well, actually, the super stretchy skin is usually only seen in the classical and classical-like types, and I think that I have the hypermobile type, which is the most common one. I did a lot of reading up on hEDS, so I could be sure that that's what I think I have, and one thing I read was that the joint instability is highly variable among people with EDS, and some people never experience full dislocations at all. And with EDS being famously misdiagnosed and underdiagnosed, I think it's possible that some of my family has it and just doesn't know it. Someone has to be the first to be diagnosed, right? You have a point there. EDS is pretty rare, so I don't know everything about the condition. Let's get you set up with a referral to see a geneticist to evaluate you. They're the ones who are experts about EDS. This scenario started out rocky, but the patient was able to salvage the appointment by calmly and politely correcting the doctor's misinformed opinions. Remember to always be kind to your doctor. They're humans too and deserve respect and kindness. If you come into an appointment with an attitude, they may become defensive and you will both have a poor experience. Next, we'll look at a scenario where your doctor just won't listen to you. Hi, I'm Dr. Happy. I see you're here because you think you may have hEDS. That's a pretty rare condition. Why do you think you have it? Well, I have really hypermobile joints that sometimes lots of people are flexible. That doesn't mean you have EDS. Well, I have a lot of deep muscle and bone pain that I can't explain. You're pretty overweight. If you lost some of the excess weight, your joints will feel much better. But I still had these problems even when I was thin, and I have all these other issues like, you seem pretty high-strung. I'm gonna write you a prescription for anxiety, and I want you to try to lose 10 pounds before I see you again in 6 weeks, and we can talk about this more then. Unfortunately, I don't think there's a way to salvage an appointment like this. In this scenario, I think it would be best to find a new PCP. Let's look at one final scenario together. Hi, I'm Dr. Happy. I see you're here because you think you may have hypermobile Ehlers-Danlos syndrome. Could you tell me a little bit about why you suspect that? I'm so sick of being questioned all the time. I'm not a hypochondriac. I have to pay a lot of money to come here. Do you think I make these appointments just for fun and attention? My left shoulder has come out of place 3 times. I can't fake that. I didn't say I didn't believe you, but I'd like you to tell me more about some of the symptoms you're having so that I can try to help you. You said your shoulder has come out before? When did this happen and what caused the dislocation? This should all be in my chart. Don't you guys look at that before you come into an appointment? I'm so sick and tired of having to do all the work for you people. You're the doctor. Aren't you supposed to know these things? We're going to stop this scenario here because I think you get the idea. Even if you've had very poor past experiences with doctors, it doesn't justify your poor behavior. Patients, just like doctors, need to remain respectful during appointments in order to facilitate a healthy patient-provider relationship. Doctors aren't magical beings who know every detail about every medical condition, and they certainly can't be expected to memorize the medical history of every single one of their patients. You as a patient are responsible for knowing your own medical history, what medications you take and why, and you are responsible for showing up to your appointments on time, even if the clinic is running behind. Clinics being behind schedule is often due to late patients or patients who try to jam their whole list of life problems into a 15-minute appointment slot. We can all do better, patients and doctors. So what are the biggest takeaways from this video? When you make your appointment, mention hypermobile Ehlers-Danlos syndrome specifically. Come to your appointment prepared. Manage your expectations. Create a list of your symptoms. Have a specialist in mind, and have a positive attitude. If you thought this video was helpful, please click on the like button. If you'd like to see more videos about hEDS, such as an in-depth review of the hEDS diagnostic criteria, what to expect at a genetics appointment, and relevant product reviews for EDSers, subscribe to this channel and click on the notification bell so that you know when a new video is released. I would love to hear about your initial appointment experiences. Please comment down in the comment section below about your personal experience and any advice that you'd like to share. Also, please comment if you have any ideas for future videos or if you have any questions for me. Thanks for watching.